You're watching this video because a surgeon has recommended a metacarpophalangeal joint arthroplasty. This is also known as knuckle joint replacement surgery. Joint replacement may be considered to relieve the pain and reduced mobility associated with arthritis of the hand joints. The surgeon will make an incision over the back of the joint to be replaced. The arthritic portions of the bones are removed and the ends of the bones are prepared for the replacement parts. Various tools are used to create a channel in the bones. The stems of the special silicone replacements are then impacted into the bone. As they heal, the replacements are incorporated into the bone. The surgeon will test the range and smoothness of the joint movement before closing the wound with stitches. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.